Hi everyone, welcome to Women Empowerment Shadowing Session. We hope that you will enjoy today's session with Dr. Siri, who will be discussing about emergency medicine. Thank you, Dr. Siri, for joining us today. Whenever you feel ready, please begin your presentation.
Hi, everyone. My name is Dr. Siri Chamarty. I'm actually an emergency medicine doctor in New York City, and excited to talk to you guys. And I hear that this is the Women's Empowerment Organization, so I'm excited because I'm hoping that a lot of you guys are female. So just an introduction. So I was asked by the organization to kind of share my educational journey and how that kind of has led me where I am, and then go over some case series, and at the end give some advice and hopefully take some questions. So that's kind of the format we'll be following. So I grew up kind of all over the United States and wound up at UCLA for undergraduate. And I'm not sure, but there's a lot of pre-meds at UCLA. So I found a lot of resources to go to medical school there. And I went to Medical College of Georgia for medical school, and they had a really strong program in emergency medicine. Where I went to medical school, we had an affiliation with a military base. So we were able to really get a lot of good experience in emergency medicine. I matched into New York City for emergency medicine residency, and right now I'm an emergency medicine fellow in this city as well. So that's kind of been my journey from undergrad to where I am right now. So what is emergency medicine? So a lot of people kind of envision the doctor that they see in the emergency department as the ER physician, and that's right. But we can work in many other settings as well. There's definitely other different types of places we can work, like concierge medicine, critical care. We can work kind of in the community and urgent cares. We can work in a host of different settings. There's some doctors who work on cruise ships, like cruise ship docs, like doctors who staff events. Some of the sports medicine doctors are emergency medicine specialists. So it's really a wide range of practice. And this is from the AMA, and they define it as kind of a specialty where you take the necessary means to prevent any further death or disability. And that's both in the pre-hospital setting as well as in the hospital setting. And basically, emergency medicine, you treat everything. So going on to the kind of like what's going on, like what people think a lot of emergency medicine is all the excitement that you see on TV, running codes, being like the doctor who does all of the resuscitations and whatnot. But in reality, I think a lot of emergency medicine is just talking. Honestly, it's a lot of counseling. You'll see a lot of people who really aren't as sick as seen on TV, or might be sicker than they appear. Not because like that's, it's just like what's exciting to see, but a lot of it is just talking and kind of figuring out like who's actually about to die and who has an emergency versus, oh, who's here and can wait and can see a specialist kind of outpatient or in the community. So that's kind of what emergency medicine is. Daily routine. So emergency medicine differs than a lot of other specialties because we don't have patients that we schedule to see us. People go to the emergency department and kind of that the work shows up for them. It's not planned to be like a busy shift or an easy shift. It just kind of happens. So the ways, what we do is we basically receive handoff from the doctor who's been there for a certain period of hours, whether that be 8 hours, 12 hours. And then you kind of manage the patients who've already been there and then see the patients as they come in. Three things can happen to patients. They can either stay in the hospital, get admitted, they can either be observed, or they can be discharged. And those are kind of like the three main things that can happen. And admitted patients can also be those patients who, need to go to the operating room for any sort of emergent surgery or whatnot. And then at the end of your shift, once it's nearing the time for you to go home, you sign out to the doctor who's coming on. Even if you work multiple days in a row, it's highly unlikely that you'll be seeing patients basically like the same patients every day. It's kind of different in that sense from someone who works at the hospital, say a hospitalist, an internal medicine trained hospitalist, because internal medicine trained hospitalists will see people on the list daily and then determine who's going to go home, versus emergency medicine doctors, we kind of set the initial tone for when a patient comes in of what's going to really be happening to them. In that sense, you have a lot of power and a lot of responsibility. And believe it or not, I feel that emergency medicine doctors make a huge impact on a patient's ultimate treatment in their hospital course. If I say a patient I'm concerned about a patient's heart, they get to see a cardiologist. If I'm concerned about a patient's kidneys, they get to see a nephrologist. And in that sense, I guide them in the correct path. When I admit them, I write, hey, concerned this patient has this sort of disease, would recommend this. And eventually they get these things done in order to figure out what's going on. So that's kind of how the daily life of emergency medicine works. If you are a academic, there's two different pathways to work at. And in the community, this is kind of all that you do. If you work in an academic center, you also supervise residents, you teach medical students who come onto shift, you teach pre-meds, all these different things. And depending on your subspecialty in emergency medicine, you may have some clinical responsibilities with the medical school you're affiliated with and whatnot in order to give lectures and stuff. So those are all things that happen. There's really a lot of variety and a lot of different things that you could do to practice. In terms of the patient population, we really see everything and everyone. We see everyone from the moment that they are born to the moment that they die. Just the other day, we had a precipitous delivery in the emergency department, and that we have deaths happening all the time, unfortunately. This is actually a picture of where I trained for residency, and you can see that it can get really busy. And a lot of people refer to the emergency department as the quote unquote shit show, because it's not, it's a very fast-paced environment where you're really required to keep up with a lot of information at once. So we see everyone at any time on any day. We're open 24 hours, 7 days a week, 365 days a year. Okay, so I was asked to discuss some cases, and I feel like this is interesting because a lot of you guys are coming from, either, you have some medical knowledge already or you don't have some medical knowledge. And I feel like it's really hard to kind of teach cases in that way. instead, I wanted to talk about things that like topics that kind of like matter to you guys as maybe people who are interested in women empowerment in the emergency medicine setting, which I thought would be a little bit more relevant. Like in the emergency medicine setting, there's, I think, a huge disparity in patients that you can see in terms of socioeconomics, but also in terms of gender. We do see patients who are women who come in who may not have the resources to make it on their own. And I know that I've definitely seen a lot of people who have been more stressed this year more than in the past. Another thing that we see is that we see women who may have been assaulted. And that's always really, really difficult because it requires us to take a systematic approach in order to both evaluate medically their assault, but also kind of work with the caseworker, social worker, and use a multidisciplinary team in order to allocate resources so that we can help them in their situation. As emergency medicine doctors, we're responsible for kind of overseeing or sometimes even performing something called the SAFE exam. This is an exam that, where we take samples from every orifice of the body if a woman has just been assaulted, and it could be rather traumatizing. If, a lot of people I don't think like people spend enough time counseling as much, but we do try our best to make this this sort of patient feel as comfortable as possible in the environment that they're kind of placed in. I put pads up here because I think, like I said, they're on TV. You'll see a bunch of different sort of cases presented to you, and you won't know if they're the correct management, right or not, because they're on TV. So I wanted to briefly touch upon the fact that there are some shows that are better than others. If you guys are really into medical shows, I would recommend Scrubs. I think Scrubs is really good. In order to kind of see what life in medicine is kind of like. And then I liked Resident, but as a resident in a certain field, you don't really work everywhere in the hospital. You might work at only certain places. Like if you're an OB resident, you might only really be in the labor and delivery, but you won't really find yourself in pediatrics a whole lot. So just to highlight that. I'm trying to think. We do see a lot of OB patients in the emergency department, a lot of patients with vaginal bleeding, vaginal discharge, a lot of people who have, who are early in their pregnancy. And I think that that's interesting that we're the first ones to share with a lot of people that they're pregnant, and we get to do the ultrasounds and whatnot to figure out where their pregnancy is, and sometimes unfortunately diagnose it if it isn't in the correct place, also called an ectopic pregnancy. So you have a lot of opportunities if you're interested in women empowerment and women's rights and women's health to actually be involved as an emergency medicine doctor. So I was asked to share some tips with students. So you guys probably pre-med or even in high school, I'm not sure. I feel like I think a lot of students, you have this notion of what it takes to really succeed. And I think a lot of you have probably done your research that, hey, you need to go to undergrad in order to go to medical school, in order to get and you need to go to a super awesome medical school in order to get into the best specialty possible and, do whatever you want with your life. But step number one, I feel like even though you might have an idea of what you're truly stepping into, I think what's most important is to always keep an open mind and be willing to learn. As a student, there are certain things that you can do to prepare yourself for the future. And I think that some of these things highlight that. So being a team member in every sense will help you in the future, because every field of medicine requires you to be a team member and be a team leader, or be a part of a community. Engage in leadership activities. I cannot stress this enough. If there is any opportunities for you to be involved from anything, like being a secretary, even like treasurer, vice president, president, all these like awesome club positions in the various clubs at your institutions, I would encourage you to be a part of it, because you'll really see how what it takes to lead other people. I think a lot of these skills can't be taught; they just have to be experienced. You have to learn what it means to lead other people. You can't just talk about it and then say, "Hey, okay, I'm a leader now." I think it really engaging in those sorts of activities will help you in your career, and can also put you in leadership positions once you do become a doctor. And that's also cool, because that means that not only do you make impact on a patient's individual life, but you can actually make an impact on a bunch of patients' lives by changing a policy, or being, in a directorship position. Foreign language is super useful. Do not do not underestimate this. I particularly think, for me, I learned Spanish in high school, and I use so much Spanish now. I wish I had learned more of it, or learned it better. It's something that someone can take away from you, and it's something that you can definitely use in your career. Like I said, I think Spanish is useful, but other languages are great too if you really like a certain area of the world, or the United States, or whatnot. But for me, I feel like Spanish is probably the most useful. So another thing is, I didn't learn this till much later in undergrad, is you don't need to study more. You need to study effectively. I know a lot of people spend a lot of time studying, and that's cool, but are they really making the most out of their time? All of you have heard the phrase, time is money. And honestly, most of you guys are very young, and your time is money. Like, it's also time to enjoy your life, because you're never going to get this time back. In order to study effectively, I would first figure out your learning style. Think about a time that you have been very successful in a course, and what kind of methods were used to teach that course, and how did you study for that course. So for me, I'm a very visual learner, and I like audio. So I would record my lectures and then watch them 2 times over. And this was 10 years ago. So I'm sure if you guys have access now, it's all Zoom. So if you're the type of person that needs to do that, then you can do that over Zoom twice, because that's what helped me retain. But some people need to draw mind maps. Don't do things that you don't feel will work for you. Just stick to the type of study method that works best for you. 5 more tips for students. Super, super important is to find great mentors. That's something that will help you in the future so much. Even now, if there's someone that you see in these shadowing sessions that you're attending, or just in general, and they're what you want to be in life, hey, oh my gosh, this person does yada, 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 and that's exactly what I want to do. then seek mentorship. Be like, hey, can you be my mentor? Can you advise me? And I'm sure people would be more than happy to at least give you some advice or direction, so advice on which direction to go in. 2, do not lie. Don't lie on your resume. Don't lie to the people who, once you become a doctor, who are your attendings, or don't lie to your residents. It's not useful, honestly. If you lie, then you will get caught. So if someone asks you if you did that rectal exam and you didn't do that rectal exam, don't lie. Failure will make you stronger. So a lot of you guys, it's a really, really difficult atmosphere right now because of everything going on with COVID, and being pre-med in COVID is really hard. You're not going to be able to get the same sort of exposure that you might have gotten previously. However, you might apply for a lot of things and you might not get them. But I would reach out every time you don't get a position, or you don't win something, or you don't get into the program that you want to, whatever, and ask why. Like, what can I do to make myself a better candidate next time? That's what I would try to reach out and ask every single time. And I think that will make you realize that you lack certain things more so than you just like aiming at the dark. You will fail a lot before you succeed. I promise you, no one is ever successful just like that. Everyone has their failures to show for it. So make sure you don't realize that it doesn't define you. Hard work shows. Every single ounce of hard work that you're putting in right now to be at these shadowing sessions and doing what you can do to get the exposure that you need will actually be super important. So that's just something to consider. Lastly, what goes around comes around. Be a good person now. I'm sure I am 100% confident it will come back to you to be a good person. Let's see. Lastly, do what makes you happy and do what brings you alive. A lot of people spend a lot of time, especially now, I like look back at it, and the regrets that people have when they were in medical school is that they didn't enjoy undergraduate enough, or now that they're attendings, like, hey, I didn't take advantage of the time that I was a resident or the time that I was a medical student. If you like ice cream, go eat ice cream after your, on your day off. Like, just do the things that make you happy, because life is too short to not do those things. I personally feel like, even though a lot of things have been taken away from us, in terms of human interaction and travel and all these other things, they've been replaced with, I think, things that make it easier for us to communicate and for us to be involved, especially being in the situation that you guys are. So just think about what will make you happy at the end of the day and do that. And lastly, this is how to reach me. You could just scan the QR code if you want. But I actually feel like if you guys want an idea of what going to medical school is like, or the kinds of experiences that I've personally had, this third link right here is actually my blog from when I was a medical student. And it actually relates like my different experiences from the first day of medical school to all of my rotations. So I think that's something that you guys can just look at if you are interested, and I'm opening it up to any questions.
Thank you so much for your presentation, Dr. Siri. We do have some questions on YouTube. So the first question we have is, what is the most difficult aspect of emergency medicine?
I think being flexible and being able to expect anything at any time. In my job, like I said, I treat everyone from birth to death. And at times you can have so many different sorts of complaints, just like you could have like a patient who has an opioid overdose next to a patient who's there for a COVID swab. And then the next thing you know, you could have like a 1-month-old coming in cardiac arrest. So like, I think like just the depth and breadth of what you need to know in emergency medicine and being able to apply all that knowledge is probably the most difficult part.
How do you maintain a work-life balance being an emergency medicine physician? How do you prevent burnout?
I get this question a lot. So I really love my job, and I think that's going to make a huge difference in terms of preventing burnout and maintaining a work-life balance. So work-life balance, I think, comes from A, working, and B, having a life. So how much you work, how little you work, how many hours you work each time you work, and how that kind of fits into your week really makes a difference. And B, having a life. So if whatever, you envision as your ideal life, if you're someone who, likes to sit at home, watch Netflix, read a lot, how do you make time for that, in your daily schedule or in your weekly schedule? That's going to be important to you. Or if you're someone who really likes hiking and being outside and taking walks, and how you even schedule that into your week will make a difference. So having both things and seeing how that can fit into a week, a month, a year, I think is going to be huge in terms of determining work-life balance. For me, I like being active. I like, working out, but I also like eating. And I love my job, and I make sure that even if I work, that I'm able to schedule like dinners with friends, or, have time for me to go to the gym, or just be able to have access to the things that I want. Like if I come home from a long 12-hour shift and I want to eat, I don't know, Chipotle, that makes me happy, then I'll order Chipotle, and that will actually probably raise my spirits if I've had a really bad day. So just finding joy in like the small things and figuring out what those small things are for you, then that will make your work-life balance. In emergency medicine, it's actually it's both easy and hard to have a work-life balance. It's easy because it's shift work, meaning you don't have patients that you have to schedule, you don't have patients that you have to recruit, and you are scheduled for a certain number of shifts, and your schedule prior to going in. So I'm going to be working on Monday, Wednesday, and Saturday this week for 8-hour shift, 12-hour shift, and an 8-hour shift, and that. So, and you don't have to do like I said, patient scheduling or anything before you go in. So you could say, hey, well, I have Friday night off, so why don't I grab dinner with someone on Friday and like do the things that I like doing. It's also hard because we switch between day shifts, we switch between night shifts, where we work like many different times of the day. So in that aspect, it's hard, but it's easy because a lot of the things that other doctors may have to do, like if you're in primary care, you have to be like, oh, these are the patients on my schedule, let me renew them over the weekend. Like your time off is your time off for you in emergency medicine. And I think that makes a huge difference to me in maintaining a work-life balance.
So can you go into family medicine or pediatric and become double board certified in emergency medicine so that you can work part-time in the ER, but mainly in family medicine or pediatric?
So if you do family medicine, so these are all separate residencies. So family medicine is a different residency, pediatric is a separate residency, and emergency medicine is a separate residency, and they all three of them have their own separate boards to take. And those boards are the like national certifying exams in order to say, hey, you are a board certified emergency medicine doctor. You are a board certified pediatrician. You are a board certified family medicine doctor. So first you need to go to those separate residencies. I think there are some, there's a couple of programs who combine a pediatrics residency and an emergency medicine residency. And those are two residencies that you're doing together. But instead of each one is 3 years, and I believe those are 5 years. So it's a little bit longer because you're getting two different certifications in terms of like that. The other thing is I don't think there's any combined family medicine and emergency medicine, because family medicine is mainly concerned with primary care and prevention, and emergency medicine is mainly concerned with like stabilization and prevention of decompensation. I don't think there's anything like that. From family medicine, you can do an emergency medicine a fellowship, which I think is like 1 year, but I don't believe that will allow you to get board certified. From pediatrics and EM, I think you're probably going to be able to get that structure where you work in the pediatrics outpatient and you could do some EM shifts or whatnot. In emergency medicine, we do see pediatrics though, but we only see the kids who are not well, if that makes sense. I personally didn't really like well checks that much, but if you're into that, then you could definitely do like a peds EM program in that way.
What kind of subspecialties are available in emergency medicine?
There's 24 different ones. There's a lot. But anything you can think of, you can probably do it through emergency medicine. There's like everything from like lifestyle medicine, sports medicine, simulation, ultrasound, emergency medical services, like a bunch of different things. There's like literally, I can name like anything, toxicology. There's like so many, I can't even think of some of them. Occupational medicine, hyperbaric medicine. Yeah, a lot. There's cardiovascular diseases where you can like become like a master of like EKGs and that kind of stuff. Yeah, there's a lot.
As a female working in the emergency department, have you ever had your leadership or decision-making questioned, and how do you deal with it?
I think more than being a female, it's being young. I think that in America, and especially in a city like New York City, there's a lot of, I think there's a lot of acceptance of gender in terms of medicine. So that's not really like an issue in New York City. I think being young though is, I think more than having my decision questioned, it's patients who mistake, like say like a male medical student who's a guy who's like taller than me or something as their doctor, even though I have been asking them the questions the entire time. So I think like that's one of the kind of things that exists is just like patient perception. But I think in terms of having my decisions questioned by another medical provider, I don't think that's as much of an issue necessarily being a female. Right now, almost like 1/3 of all EM doctors are females. So it's definitely like a growing field for women.
As a follow-up to the subspecialty question, someone is wondering, are the subspecialty available to PAs as well?
That's a good question. I work with some PAs, and So how PA school works is it's 3 years, and there is an emergency medicine PA fellowship. And I know that this exists, but I'm not sure if there's such a thing as like a PA toxicology fellowship or anything like that. But I'm sure that definitely PAs can work in these fields without being necessarily certified as such, because if such a thing doesn't exist and they have the interest and there's a capacity for them to work, then why not?
If not emergency medicine, which field of healthcare would you go into?
Or what specialty, I guess. So there's a few that definitely I think we do a lot in emergency medicine. The ones that I like using my hands. So in emergency medicine, we do use our hands a lot. Like we do a lot of procedures, and in that way, I really liked anesthesia, and I liked internal medicine. But I don't know if I'm more interested in the like actual medicine, but maybe like something like critical care, interventional radiology, maybe even like surgery. And those are like the main fields where I feel like would be kind of like close to emergency medicine.
How did you find your study or learning style?
Good question. Like I said, look at a course or anything that you've done super well on and kind of reflect on the things that made it easy for you to learn that material. For me, I need to, the way I the way I learn is a very conceptual. I need to figure out why I'm learning what I'm learning and have a way to organize that in my head. So if I create like a graph, for example, like A and then B, C, and like it has to flow in a way that makes sense to me. And also I grew up listening to like a lot of audiobooks and stuff, not for like medical stuff, but like that actually helped me become a really good listener in terms of learning. So I felt like more comfortable when I had someone like just speaking, even if it's like at 1.5 times speed or 2.5 times speed on a subject, and kind of reviewing the slide in that way. And I had to listen to it multiple times and have the teacher or the instructor say multiple times that like, I don't know, like some crazy concept in order for me to go, aha, okay. Also, people generally test on concepts. So it's really important to understand concepts and not necessarily like memorize things.
What was the largest obstacle you had in your pathway to going into medicine?
I would definitely say the largest obstacle for me, which may be for some of you as well, was not having anyone in my family or like any of like my family friends really like be like a mentor for me to go into medicine. So I didn't know a lot of the things that maybe some other people knew until unless it was specifically advised to me. So growing up, like some of my friends, their like parents would be like, professors at a university, and they'd be like, yeah, this summer I'm doing research. And I'm like, wait, I'm supposed to do research this summer? I definitely thought I was just gonna, I thought I was like gonna chill. So like, I didn't know a lot of things, and I didn't know things about getting into medical school. Like, hey, you need to shadow people. No one explicitly told me that it was a requirement until I was filling out the medical school apps, and they were like, oh, okay. Now it's not less so because of COVID, but back when I was applying. And then also like how hard it was to like shadow people. It was insanely hard. Oh my gosh. Like I remember emailing people and they'd be like, no. And And then I'm talking to people now and they were like, yeah, I just like went into my mom's office and like she hooked me up with like a bunch of doctors and I got to see all these cool things. And I was like, oh, okay, well, I definitely didn't do that. So I think it's really hard if you don't have someone who you're directly like related to or who's able to like offer you these kinds of opportunities in order to really do them. So that was my main obstacle, is like not having that kind of like mentor. And then eventually being at a school as large as UCLA, there were almost like 4,000 people in my class. And of those 4,000 people, I think like around 600 people apply every year for like medical school. So it's really, really competitive. And it's a lot of people are doing all these crazy and cool things. And as you hear about them, you're like, oh, okay, is that what I should do to get into medical school? Is that what I should do to in order to be a doctor? I say that like of all those things that people did, I don't think a lot of people did those because they actually enjoyed them, like, but rather that they felt like they were GPA boosters or resume boosters or whatnot. I really think dedicating your time to like the things you like is actually going to show more than being involved in like 15 billion different things and kind of showing for that. So I would say right now, it's really, really hard. If you have anyone in your family who's in medicine or who is easily accessible to you who is in medicine, then that's the place to start when it comes to kind of asking for advice. And a lot of stuff you won't know or won't know that you needed to know until you get there. And that's just kind of how it works, unfortunately. And no one can even tell you the intangibles of what they thought you needed to know until it happens.
Are there certain areas of your job that allow you to advocate for equity for your patients and or peers?
And or what?
Peers.
Patients or peers? Oh, okay. Yes, definitely. Even though I am still in my training, but I also work in the ED as an attending. There are multiple opportunities for advocacy. In fact, even if I didn't have my current position, even as a resident, there are opportunities for advocacy. As a medical student, there's opportunities for advocacy. And even as a pre-med, there are opportunities for advocacy. It just has to start with intent. So for me, I'm luckily in a position where I provide patient care and I can actually advocate for improved patient care or certain things that maybe are shunned upon by society. Two different examples. One example would be like if I saw a patient for sexual assault, but then 5 minutes later, another person had to come in and talk to the patient again about the same experience. And then like another 5 minutes later, like another person came in, like a social worker came in, a case manager came in, the domestic worker, like, and all of these patients saw that same patient at different times versus all of us seeing this patient at the same time. So they only have to relay their trauma once. And stuff like that is an easy way to advocate for your patients and the way they feel. Another example is in opioid users. So like opioids are like heroin, fentanyl, carfentanil, all of these kind of medications can unfortunately result in death if there's such a high dose involved. And the reversal agent for this is Narcan. It's actually intranasal Narcan. So it's just like something you shoot up the nose like that. And the patients luckily are reversed sometimes and they wake up and they kind of go about their lives. Narcan is something that can be given to family members and can be given to like the patients themselves in order to be a life-saving device. So in case EMS is taking a while to arrive, the family members can give it to the patients. That's another easy way, is if your emergency department doesn't have Narcan to give to patients, easy way, Relay for Life, that's the organization. They try to help, and we coordinate with them. And luckily this year, even as entering a new institution, I was fortunate enough to be a part of the efforts to bring that to patients. So I think that there's so many ways. You don't even realize how many ways you can help patients, and just the small things, especially in a place like New York City. Like I showed you a picture of the hospital that I trained at and how many patients there were. And there's no way to, unfortunately, like truly isolate these patients. They're just wearing masks, like even advocating for, you know, certain family members either not being there or being there for a patient at bedside is like super easy. Advocating for my peers, of course, we always like support each other. I think emergency medicine is a very collaborative field. There's plenty of ways where we can all support each other on shift. Make sure that if someone is in the middle of running a code, you can definitely be that person to, you know, jump in and help in on the code, or make sure that the other like patients, like if there's anything that they need, like you're able to kind of help them and stuff.
How important would you say research experience is? Is it crucial to get published?
For medical school?
I think so, yes.
Okay. No, it's not crucial to get published. And research. So if you apply to medical school, okay, you want to become a doctor of medical sciences. And in that is science. So you have to know the scientific method. That's just plain old dandy. That's something you got to know, something that's going to come up and up again. And I definitely wish I knew more about statistics than I actually do, but actually, like, research is important in the sense that it's important to get exposed to some sort of research, whatever it is. If it's lab work, it's lab work. If it's clinical research, it's clinical research. If it's if it's like some sort of virtual project, it's some sort of virtual project. But just getting in, kind of being involved in that real life scientific process is like something all of itself. So I think in that sense, research is like super important. However, some people, they just aren't researchers. Like that's not their forte, that's not their interest. And that's okay. Not everyone is a researcher. But it's important to show that you've at least exposed yourself to that. So work in a lab, or, you know, work on some sort of project, and just show that you've taken initiative in to get at least some experience in the sciences. It's really hard to publish, actually, if you're not in a field that is like pumping out papers like every day. And most people aren't in those sorts of fields. Most people are doing like cold, hard bio research. I personally was in a couple of different labs in undergrad, and not like lab classes, but like labs where I went in and I sort of got some exposure to different sorts of research. And it was never my forte. And I didn't get published in undergrad, and that is okay. But I made up with it by showing, you know, my other interests, and that's okay. You can show your other interests and shine in the way that you can.
So the last question we have is, do you work with any nurse practitioners? If so, how does their job differs from yours?
NPs, I sometimes do. Not too often. I used to in residency as well. Nurse practitioners are people who have gotten a nursing degree, who have went on to pursue a kind of an advanced degree to obtain a licensure in order to kind of provide treatment without kind of the oversight of a physician necessarily, and also a different kind of role than just a nurse. They are trained professionals, like with a slightly different area of expertise. They, I feel like, work in a lot of settings where they provide care for lower acuity complaints, and physicians provide care for all sorts of complaints. I have yet to really work with nurse practitioners who really care for patients coming in with like cardiac arrest, STEMIs, yada yada. I'm sure they do in maybe other hospitals, but in terms of the hospitals that I've worked at, they've mainly been treating patients with like lac repairs, or who need med refills, or what be it or not, So they basically they're very different. Physicians are pretty much able to prescribe and treat every condition under the sun. And I'm sure maybe nurse practitioners are licensed as such, but mainly they practice in a lower acuity setting.
Thank you, Dr. Siri, for joining us today and teaching us about emergency medicine. It was truly a wonderful presentation. For those watching this, the link to the quiz will be posted on our link tree found in the Instagram bio and has also been posted in the chat box. Our Instagram ID is way_organization, so please make sure to have a look at that as well. And within this week, we'll also be emailing you your certificates. Thank you once again.
Thanks everyone for coming. Hope you